Good afternoon, Cedarfield family. Hope all is well with you on this fine December 30th at 3 o'clock. Thank you for tuning in here live at 3 o'clock. Those of you that are at home, sitting on your couch, listening to this video, we appreciate you taking time out of your personal life to listen to some information about our COVID-19 education, our rollout plan, and other general updates about our evolving preparedness plan. Today's format is very simple. It should be about a 20-minute, 25-minute live chat here. You have yours truly, and Margaret is here to share some great news. So first, just talking a little bit about the current situation in the Commonwealth of Virginia. Our 7-day positivity rate throughout the state is now at 12.5. Just 7 weeks ago, we were at 9.6. Central Virginia is at a 15% 7-day positivity rate, and that is up from Monday at 14.3. Henrico County is, Henrico County is slightly up from 8.5 to 8.7. Richmond City is slightly up from 7.1 to 7.4. And Chesterfield is slightly up from 12.9 to 13. Those are our 7-day positivity rates. Everything around us has increased pretty significantly and or slightly. Here at Cedarfield, our dashboard in the health center, which consists of 3 neighborhoods, our north neighborhood, south neighborhood, and central neighborhood. All 3 of those neighborhoods, thankfully, are green for residents and team members. In assisted living, same is true. Thankfully, in assisted living, our dashboard for residents and team members is also green. In our memory support area, otherwise known as Sunshine Plaza, our dashboard is green for residents and team members. In the main building here, for independent living apartments and those team members that work in and around the main building, our dashboard is green for residents and team members. And for the cottages, I'm going to put our dashboard as yellow right now, just because I need more data. We do have one COVID positive case of a team member who works in and around the cottages, and we are actively contact tracing that particular team member, as well as the contact trace list to see if indeed our dashboard should remain yellow right now in the cottages. But for right now, what I've been told is that it's a very low risk item and that there's very low exposure. So those of you that live in the cottages, please don't stress about this until I have further, if there is any other precautions that we should take inside the cottages, I will definitely communicate that those precautions much sooner than later. I won't wait till Monday. But assume for now, no news is good news. Second piece to our live chat just has to do with education around the vaccine. I know on Monday I promised that there would be a flyer that would be published to residents and team members today by 5 o'clock. I'm still hoping to get out that memo. It's a frequently asked questions memo that was produced by the Pinnacle Living Office. And it's a good read, gets back to some basics. So if that memo doesn't come out today by 5 o'clock, I promise it will be in the team members' hands by tomorrow morning and in your cubby box here in the main building and or your mailbox early tomorrow morning. So again, it's a general update about some frequently asked questions. But just as I've been spending most of my nights here for the last 10 months of reading about COVID-19 and now recently with the vaccine, again, I intend to get the vaccine once it gets here. I really believe that it's just a remarkable development akin to the polio vaccine, discovery of penicillin, treatment for HIV, all the things that I'm reading and or listening to of other experts. I believe it's a safe option for me, and I believe it's a safe option for really everyone to get this virus under control. It's absolutely a testament to medical science. The team members that are out there and or residents who are still on the fence and haven't filled out their vaccine administration record, I believe that medical science really recognized an obvious problem early on. If you read some of the documentaries, back in late January, early February is when they really started to develop this vaccine. So they recognized the problem very early on. They researched why it was happening. They studied what could alter it, and then they implemented these measures that we are rolling out to 2.3 million people today. So along the way, they've made some mistakes, and the medical field and science will learn from the mistakes and make this process even better moving forward. I truly believe that getting vaccinated significantly protects ourselves and Cedar Field from this COVID-19 infection. The potential benefits of this vaccine, in my humble opinion, far outweigh the very small risks that are associated with it, of what we know thus far. And I'm going to list a couple of things. If you who are listening tonight or today, if you are a team member or a resident or a family member who has influence over a resident and or a team member, if you value any of the following items, then in my humble opinion, getting the COVID-19 vaccine will improve our chances of achieving goals as soon as possible and returning to some level of normalcy at Cedar Field and in society in general. If you value the following, I strongly encourage you, those of you that are on the fence, to consider gaining more data and information and connecting with our experts here at the community, namely our medical director, our infection control nurse, Connie McGowan, wellness clinic nurse, Ann Hopper, and as I mentioned, our medical director, Dr. Varanian or Dr. Shear. Here's my list. If you value the following, if you value social connections with family, friends, and your faith community, if you value in-school education for our children, if you value an open and unrestricted society with freedom of choice and movement, if you value good food and local restaurants, if you value financial stability of local businesses and a flourishing regional economy, if you value music and theater and performing arts, if you value traveling with unrestricted access to different modes of transportation, if you value faith-based care of our bodies inside of temples and churches, if you value protecting our elders and residents who live in congregate living spaces, if you value cheering on the Philadelphia Eagles, a sports team, if you value living life with less discomfort and fewer limitations, if you value any of that list, which I know many of us do, for those of you that are on the fence or have actually said, no, I won't take the vaccine, I just urge you to reach out and can we have a conversation about the data around this vaccine with myself or with other experts that we have at our fingertips, including the Virginia Department of Health. I just got off the call with them about an hour ago and asked them if someone at Cedarfield wanted to talk with an expert outside of Cedarfield to get another lens of the data and the information. Can I go on a public service announcement to make that available? And they said absolutely, without question, tell them yes, they can. So if anybody would like to reach out, please feel free to either call administration and we can definitely get you some of the contacts that are really close to the data, the epidemiologists that they're using from the CDC and the Virginia Department of Health to educate the general public. Speaking of educating the general public, the Virginia Department of Health has produced a 45-minute video. And this video is really geared towards the African American communities and addressing their very specific concerns about getting the vaccine, given the fact of over decades ago how those particular communities have been have had less access to vaccines and therefore less trusting of the government right now in rolling this out. This video is a very powerful video, again, produced by the Virginia Department of Health. If anybody would like a copy of it, please feel free to reach out to me. We intend to use it with the Cedarfield team in different small group settings within departments and or the neighborhoods. So I think the next week here, next 2 weeks, 3 weeks, the name of the game is to really concentrate on good, sound education and not take for granted that we have a healthy number of people who have completed that vaccine administration record by Walgreens so that we can all just be 100% confident in what we're doing when Walgreens finally gets here. Speaking of Walgreens, I do have some new news. I have good news and I have indifferent news. So we got off the call with Walgreens this morning, and they backpedaled on us a little bit. And so they asked for a confirmation of how many vaccines were needed at Cedarfield. And we gave them our number, which is a very healthy number for the whole campus. And the next question was, is this just for your nursing home, your long-term care area? And we said, no, this is for the continuing care retirement community. We have team members and residents moving throughout different levels of care all the time. had said that there, as many of you probably have been hearing on the news today and yesterday, there was supposed to be 17, some of the news is reporting 20, but 17.8 million people should have been vaccinated by tomorrow. And as of yesterday, there were only 2.1 million people. There's two things that are going on right now. One is the supply of the vaccine getting to the states, and then the second is the providers having the infrastructure to be able to really administer that level. Providers meaning Walgreens and CVS. And so, as I stand here this very second, Walgreens has enough vaccine to only provide the vaccine for the health center at Cedarfield and the health center of any CCRC in Henrico County. They are only concentrating on nursing homes or health centers. They're not even concentrating on assisted living communities. And so by the end of today, we will probably, so the good news is the vaccine should arrive at Cedarfield probably middle of next week for the residents who live in our health center and the team members who work in and around the health center. So that's the good news. The indifferent news is that many of us are still going to have to wait for further guidance from Walgreens, who's getting their lead from their contract, a contractual agreement with the CDC. So, sorry to deliver disappointing news. They backpedaled on us after telling us 3 times that our entire community would be vaccinated all in one day. So, on behalf of Walgreens, I will apologize for being the messenger of that over the last 2 weeks. But the good news is it should be here next week, and it starts the ball rolling because we want to get as close to 100% as possible here at Cedarfield vaccinated, in my humble opinion. So that's my COVID-19 update. I'm going to check my texts for any questions that have come in. Anybody has a question, you can feel free to text here, the number up here by the microphone. If anybody has any questions or comments, absolutely, please feel free to call down to administration. Feel free to call our infection control nurse, Connie McGowan, or the wellness clinic, or touch base with any of the clinical leaders in the licensed area neighborhoods. I don't see any texts coming in here. Feel free to, like I said, feel free to email or call or stop by with any questions. We're going to have a good news segment here with Margaret in a couple of minutes. We are approaching a new year, a New Year's Eve, and I have seen and tasted the menu that Dining Services is prepared to serve residents across the entire community, and it is outstanding. Beef Wellington is one of the most difficult entrees to make, and we have individualized beef Wellingtons available for residents across the continuum. So it should be a great couple of nights here. The staff have worked, and residents have worked very hard to put these 2 days together to have an event here for the tail end of the year. So Happy New Year to everybody as we put 2020 behind us, learn lots of lessons from this year, and utilizing the lessons and the energy and having a great New Year's Eve, great New Year's Day, and pray that our 2021 year is filled with blessings and abundance of joy and getting back to normalcy. So With that, Margaret is here to share our good news.